Hello everyone, I'm Dr. Abha Mahashur, consultant chest physician at Lilavati Hospital. First of all, I would like to congratulate all the women. Happy Women's Day. You all have been the backbone throughout the pandemic and have worked shoulder to shoulder with us, the healthcare workers out there at the hospitals. We are here to address some of the queries and some of the common concerns which we all have in our household to keep our households COVID-free. Let's begin with the first question. How to handle household deliveries? Firstly, I would like to request, allow the deliveries to come in a bulk than having small individual parcels arriving at your doorsteps. Keep a basket outside as a delivery basket and let the delivery person keep everything in that basket. Receive things only with a mask on your face, and after you keep them inside your household, please wash your hands with sanitizers. You have all different kinds of surface disinfectants available with minimum 75% of alcohol. Spray the whole parcel, smear it completely with the disinfectant and leave it aside. After 48 to 72 hours, you can practically use them like you were using before the pandemic. How to handle clothes and linen in the household? Firstly, we need to know that this virus requires moisture to survive. So what it means is that handling of clothes is extremely important. So the ladies must know that if you have a healthcare worker coming back from such areas where they are exposed to viruses very often, then in that case, they must use a separate set of clothes to their workplace. After they come back, remove the mask, wash your hands and immediately go to the washing area. Preferably, you should wash your clothes with normal soap water. If you do not want to do that, at least keep them in a separate area like drawers which are a little tight, and you can wash them together. At any point in time, avoid mixing your clothes with the rest of the family members. In the other situation, if you do not have a healthcare worker, still you got to be careful when you're coming back from the crowded settings. Again, follow the same rules. Remove the mask, wash your hands and come back to your washing area first before you mix with any other family member, and do the same etiquettes like washing them with soap water. You do not need a separate special detergent in these trying times. Just use the same old good detergents which you were using before. How does a COVID-proof household look? I think it's one of the most important questions which we need to answer today. So let's start with the entrance. All the entrances must have a hand sanitizer so that you sanitize your hand when you are going out, and you can offer one to a person who's coming to your house, be it a family member, be it a friend, or even a delivery boy. Let everyone sanitize their hand. Second, there must be a pack of masks kept over there so that you do not forget to wear one when you're stepping out to any place, be it meeting a friend outdoors or even to normal crowded areas. Must wear a mask. And also you can offer one when you have guests coming over. Do not allow people to step in without a mask in your household. That is the most important part. Thirdly, you must know that your hand sanitizers, disinfectant spray should be a usual part of your rooms, which is the best way to take care of all of us together. Then the most important part of our household will be extremes of age. So if you have children in the house, you must know that they are super spreaders. They may or may not have symptoms, but they can carry the virus inside the house, especially if they are going down to play or even otherwise. Children, be careful of their symptoms. Coming to elderlies, again, anything which is unusual, you must raise the alarm at the same time. Those are the only population where we are stressed because they are more prone to all sorts of complications. So be careful. It's not something to have a panic about. It's something which can be done as naturally as any other thing for a lady in the house. Is there a difference between male and a female COVID survivor? Answer is unfortunately yes. Females are bound to get way more symptoms even when they recover from the acute phase of illness. So when you get them back after their discharge from the hospital stay, please know that they are going to get more symptoms in terms of fatigability, sensation of discomfort while breathing, or general tiredness. And we have found that those ladies who have required intensive care settings while they stay in the hospital, again, the proportion of their symptoms is way more as compared to a male who would have required an ICU. So what it means is, please take care of their symptoms, address the physical issues and also address the mental issues at that time. You got to reach their mind space. Take care of those small little hurdles or anxiety which they have, and do not shy away from reaching out a help, maybe someone to talk to her, maybe a psychologist or a psychiatrist. And Rehabilitation is extremely important. If you see that the fatigue is not going, or if you're not able to sleep at all when you go back home, please address these issues with your doctor, and doing a pulmonary rehabilitation is an excellent idea right now. Should we take vaccine? Answer is yes, a big yes. All the ladies must take vaccine. Now we have two exceptions which we need to talk today. One, if you're pregnant, and second, if you're lactating. Avoid taking vaccine right now because we do not have enough data to say whether it is safe for you and your child. Other than that, there are no as such contraindications unless you have an anaphylactic reaction or an allergic reaction to the constituents used in the vaccine. So that you must check and then go ahead for your vaccination. If you are on blood thinners, dual blood thinners, it is not contraindicated. Just get in touch with your treating physician. You may do a blood test to just check if your blood is not extra thin to give you bleeding at that site. That's it. Now, if you have someone who's just taken vaccine and come back to the house, we must know that the person may get fever, you may get a bit of fatigue, or you may get pain at the injection site. But again, do not worry. The symptoms continue for 36 hours post-vaccination. After that, they gradually fade away. How to handle a family member who has been diagnosed as COVID and has been advised for home quarantine or isolation. So quarantine means when the person does not have any symptom and they have been just told to stay in their rooms. Isolation means when the person has symptoms but they are not enough so that they need hospitalization and can be managed at home. Both the scenarios, please understand that the person must stay restricted in a room, preferably with an attached washroom there. You can supply them food or other articles from outside. You can keep a small table outside the door. Whenever you want to keep something, let them know that the door should be closed. You wear a mask, keep it on the table and then leave from that area. The person can open the door, take the stuff which you have kept at the table and use them. Do not mix their clothes or linen with your washing outside the room. Let them handle their linens inside for the duration they have been told to stay in the quarantine area. Secondly, you still need to monitor the person. So keep a good check. Maybe we have in our electronic era, keep doing video calls, so stay in touch. Have the alarms in place from the doctor. You must know that if a person is getting breathless in the house, you have to immediately contact the doctor. If any point in time, if the oxygen levels are going below 95, please address these concerns in a hospital, not at the home. In the end, I would like to say, take care of yourself. If you are doing good, you're going to take care of everyone very well, as you've been doing all along. Happy Women's Day.